Hey,
Dr. Bishop, what have you been studying on the computer today?
oh, I've been reading about sleep. You'd be surprised how many Americans have sleep problems.
Well, I believe it. What are the stats?
Oh, about a third of married couples sleep apart due to snoring, and about half of people snore. Yeah.
Oh,
And around 7% of people have sleep apnea.
and sleep apnea interferes with your breathing, right?
Yeah, sleep apnea used to be thought of as old people having it or people that are overweight, mostly overweight people. But you can be a skinny mini like you and actually have sleep apnea too. Basically, the way you know if you have sleep apnea is you can take a sleep apnea test. But the other one is that if your partner, whoever you sleep with, says in the middle of the night you stop breathing, or you stop breathing for a while, then gasp for air, or some people wake themselves up doing that. So clinically, I've asked patients before that weren't really responding as well as I liked, for example, migraines or fatigue and things like that, that if their partner saw that. And I was surprised one day a migraine patient said, "Oh yeah, my partner tells me all the time I stop breathing." And I was like, "You need a sleep apnea test." And once that gets resolved, uh, energy gets better, headaches get better, pain gets better, all kinds of things.
Right. So that sounds like something someone can talk to the doctor about and get taken care of. Well, sleep apnea, snoring, there are lots of different ways that people have bad sleep besides those.
Mhm.
What can improving your sleep help us with?
Well, this article talks about all the studies that it reduces heart disease, improves blood pressure, reduces stroke chances, helps with diabetes, balances your sugar level, helps with respiratory problems, and helps you reduce accidents, falling off ladders or car accidents, increases your libido, slows skin aging, helps with weight loss and mental acuity. People that sleep well also make better decisions on what they eat, interestingly enough, what kind of foods and things. Basically, it helps everything.
I came across a study that talked about how the brain cleans itself through the glymphatic system, and that is most active when a person's in sleep.
Right.
So that helps to keep the brain clear of toxins
Yeah, that's
to
so
sleep.
cool. It was so interesting when you did that.
So you can heal yourself better and faster when you are spending more time in quality sleep.
Yeah,
Kind of the
absolutely.
idea. So people talk about what they do at bedtime. I call it sleep hygiene, your bedtime ritual. What do you think about when you think about your own sleep ritual at night?
Well, I made up my own word to make it special, and I call it yoru, which is a Japanese word for night. So it's kind of my night ritual. And, this is pretty common. You can see this on the internet, but basically, what sleep doctors tell us is to pick a time to go to sleep roughly. So, 11:30, 10, whatever it is, before midnight. In Chinese medicine, they often say is better because your melatonin is rising around, is at the highest around midnight. So what I do is I pick a time and I stick to it every night. And about 30 to 60 minutes before I go to sleep, I start to wind down. No electronics, no blue light things, no TV, things like that. And I just start to wind down. That's what I do.
Right. And I know you keep your bedroom very dark.
Yeah, I need darkness. My friends will tease me that I could live in the dark. I can see in the dark. They're always amazed I can pick up objects and things like that. So I like dark, quiet. I like quiet too. Some people like music and white noise, and that can be helpful. It doesn't work, so well for me. Um,
Well, the idea of bedtime is important. And in traditional Chinese medicine, different organs do different tasks during different parts of the day. And so, for example, for cleansing of the liver, it's important
right,
that you're asleep by like 11.
right.
So it's important to consider your bedtime if that's within your control.
And also, if you wake up in the morning and you feel really kind of dragging, it means your liver didn't clean your blood out. Traditionally in Chinese
Ah,
medicine, yeah.
interesting. So yeah, I think another thing related to the pleasant sounds is to make sure that you're not watching anything violent that might cause nightmares or watching cable TV news. I know you mentioned that's something you see in your clinic
Yep.
as a sleep disruptor. So, watching something controversial or having a controversial discussion with someone, those types of things can be left out of your nighttime ritual.
Yeah, I think I've fixed a lot of people, if you will, by telling them to turn off the cable news and to stop watching, violent TV at night because it does rile you up. Even though you're sitting in a chair, you're having a reaction to it. And watch comedy. I told a lot of people during COVID, just find your favorite comedy show. Even if it's a rerun, it's even better because you don't have to think as hard. It's really helpful.
Well, a lot of things that are helpful for our health in general are also helpful for our sleep. So I know Dr. Bishop has found a list of things related to sort of like our mental health, breathing, and meditation. So can we go over some of those?
Yeah, one is a practice of gratitude, saying what you're grateful for at the end of the day and also at the start of the day. And it takes a few weeks, but your brain actually starts to change with it, and they've seen that on MRI studies. And I've taught classes where some of the students practice it with their children, and I even heard of 3 generations of the grandparents, the parents, and the grandkids practicing it. So it became like a family tradition. And some people do it around the dinner table at night. But to list what you're grateful for is a great way to go to sleep. Um, there's also this idea of your inner compassion work. They call it inner compassion work, which is really getting your own superhero. And your own superhero is, well, you know how to talk to your best friend. If your best friend has a bad day, you know how to say, oh, you're a great person or whatever. And it's to do that with yourself. So that's called inner compassion work. Meditation is often great, but again, that's not something that works overnight always. Sometimes it does. Some people that think too much, it makes them worse. However, I've been doing a meditation app for over a year, and somewhere along the way, I just noticed it's easier, it's better. If I get scared in traffic or something on these crazy South Florida roads, I start breathing correctly because I've trained myself. Breath work is another one. So a lot of people hold their breath up in the chest to use full breath and things like that. Progressive relaxation, that's one I like too. You start with the top of your head, you relax, go to your face, all the way down to your feet. And usually if you start at the head and go down, it kind of lowers your energy, makes you feel more relaxed. And if you need to power up for something but be relaxed, you do the opposite. Start with your feet and go all the way up. So those are, all those are measured in months, not in minutes. So those are things you can practice.
One thing I've noticed is that I will have a hard time getting to sleep on occasion if I had something happen during the day that my mind is racing around and trying to figure out. So this would be things like a worry or a perceived injustice, something that is causing me to play the scene over and over in my mind. So those types of issues can be alleviated by taking an over-the-counter sleep aid or an herbal tea, or you can distract yourself with comedy, like Dr. Bishop mentioned, with a game or calling a friend who's supportive.
So maybe your bed should only be used for sleep, decorative pillows, sex, and folding laundry.
And you need to make sure your bed is a comfortable place to sleep. I know that for me as a side sleeper, I have to have a pillow that's very low to keep myself in some kind of alignment. Some people need heavy blankets, some people need very lightweight blankets, some people need to wear socks. Um, Tell us about the device that you've found out about for raising the covers over the feet.
Yeah, my friend, he is an acupuncturist too, and he would take a nap on his massage table that he did acupuncture on. and he would lay on his back, and he was always a side sleeper. So he found that he didn't have like a blanket on top of his feet. And if he had weight on his feet, it made him turn to his side. So he got something called a blanket lifter, which I'd
Oh,
never heard of. And you put it underneath and it lifts the blanket off so it doesn't touch your feet. So some people with neuropathy and very sensitive neurologic problems in their feet use it. And it so I bought one to try it out, and sure enough, that you don't want to go to your side as you're not as prone to go to your side.
another thing is how old is the mattress,
Yeah.
and what condition is it in? So it's kind of like the old story of the frog in the pot of boiling water. You don't really notice how bad your mattress is getting because it's progressively getting worse over many nights. But changing out the mattress can really help.
Yeah, I've helped some people's backs by just saying, how old is your mattress? And often I'll hear, oh, my wife and I were talking about changing that. It's 20 years old or something like that. And talking to people, they often ask me what's the best mattress for me. And having surveyed patients for 25 years, there seems to be no rhyme or reason. The old rule is if have a lot of extra tissue on you, you do better with a hard mattress. And if you're very, thin and don't have a lot of extra tissue, you do better with the soft one. But I haven't really found that's true. So it just really seems to be trial and error. Same with pillows. You can have a $5 pillow that works great over a $200 pillow and that type of thing. So a lot of it is trial and error.
We've got a list together of different things that you can eat and drink that can cause problems with sleeping. And a lot of these are things that might be considered stimulants. So these are things that are going to get your autonomic nervous system revved up. Things like caffeine, Monster energy drinks, and also weight loss supplements.
That's right. And there's a lot of other medications that might surprise you, allergy medicines, and just check the label, see if it affects the sleep. And another one, it's a depressant, is alcohol.
Oh,
Alcohol, kind of has a myth about helping you sleep better, but really it disrupts your sleep. And often people, because of the sugar level, wake up in the middle of the night with it.
so that would disrupt your sleep more in the middle of the night rather than at the beginning of the night.
Exactly. And also, if you are used to drinking every night and you stop, often it takes a few days or more, depending on your alcohol level, to readjust that you can sleep
Mhm.
better.
Also, it's been found that eating late at night, right before bed, can cause sleep problems during the middle of the night and also can cause nightmares.
Yeah, there is some stuff about that. Your blood likes to go to the liver to get cleaned out at night. So if you eat anything, there's blood going to your stomach to digest it and move into that.
And I think that one thing that's very important and is kind of common sense is looking at how tired are you when you're trying to go to sleep. If you watch a family try to get their little toddler to go to sleep and they're not tired out, it's a big hassle. But if the toddler is tired out from being exposed to lots of new things and from running around, then they will conk out just like that. So it's important that you look at, am I tired in my mind when I go to bed? And am I tired in my body? And those two things will have different ways of tiring out. Exercising your mind with a puzzle is different from exercising your body with some jumping jacks or something like that. But if they can both be tired out before you go to sleep, that can help you have an easier time getting to sleep.
Yeah, some people do like evening stretches. There's actual research on walking after you eat, 15 minutes. You don't have to do anything rigorous. There's studies on yoga, Tai Chi, all kinds of different movements that will help your sleep. So daily, regular exercise helps with that. And some people, they're athletes, and clinically, I would see, kind of the story would be, they did a lot of sports in college or they were on the volleyball team or something like that. Then they graduate and now they have a job, a cubicle job, and they're not running around like they used to. And they're an athlete, they need the move. So the worst thing for an athlete is to be stationary like that. What's that new thing? The sitting is the new smoking type of thing. And another study just came out that if you walk around 5 minutes every hour, I think it was, that it increased all kinds of health indicators too. There are some other things you can try. One is called earthing or grounding. And there's some research on that helping sleep. And really simply, all you have to do is, hopefully there's no snow outside, is go stand barefoot out in the grass or the dirt. And I think the study is around 10 minutes every day, and that improves sleep. So that's an odd one, but it actually works. From Olympic athletes, I learned about jet lag and watching the sunrise. Get out there before the sun rises and watch it come up perfect at the ocean, get at the highest place you can or somewhere like that. Watch the sunrise, let it hit your forehead and your chest if you can, and that often sets your clock back. And it works particularly well if there's no clouds and you can really see it well. So sunlight is connected with your things of sleeping better. So in Chinese medicine, we talk about if a patient comes in and you're treating a condition and they come in and their sleep's all good, their bowel movements are all good, and their energy's good, we call these the three bigs, they're already doing well, then we know whatever condition we're treating is going to be easier to work with. So sleep is just essential for all parts of your health and long-term longevity too.
We hope we've given you some good tips today for improving your sleep and subsequently your entire health. Please like and subscribe our videos, and thanks for watching Unleash Your Healthy Self.